everyone, my name is Alexis Schreiner, but I like to go by Lexi, and I'm the website creator for the Deaf Culture versus Nursing website. So, just like a little bit about me is that I'm currently majoring in health sciences, and I'm set to get my bachelor's degree next summer, which will be a year earlier than I was supposed to graduate, which is pretty exciting. But after I get my bachelor's degree, I plan on pursuing my ultimate goal of becoming a nurse, well, more specifically, a neonatal nurse in the Tampa area. So the website was created with the intention of informing the viewers about deaf culture within the healthcare system, but more specifically from like a nursing perspective, but it can all easily be wrapped up within the healthcare system as a whole. But basically the goal of this website is to inform healthcare workers and anyone who may be interested in deaf culture and the role it plays within the healthcare system, and how the different issues related to the communication with deaf patients and how it needs to be greatly improved to ensure that these deaf patients don't feel reluctant to come get the health care they need, and that they're able to be communicated with properly, that'll allow for all the information from their point of view and from the doctor's point of view to get across effectively. Within my website, I made sure to incorporate a lot of different articles, whether that be peer reviewed or non peer reviewed, to demonstrate and get across how deaf individuals feel when they're entering different healthcare settings and they're being communicated with the healthcare professional, but more specifically nurses and things along those lines. I incorporated several studies that showed how deaf individuals feel while entering these healthcare settings, as well as how nurses feel that they are equipped and knowledgeable in the different areas when it comes to effective communication with their patients as well. For someone who isn't naturally hard of hearing, simply going to a medical setting can be very daunting and scary. So now imagine if you were deaf. Deaf individuals who are seeking healthcare go through a lot of significant challenges with communication when it comes to healthcare providers. Many experience a lot of frustration and mistrust due to the lack of preparation that these healthcare workers go through to learn how to better communicate with those who are deaf. So a lot of these articles incorporate a lot of different studies that show how deaf individuals feel about healthcare settings, as well as how nurses and other healthcare professionals feel that they are knowledgeable in the areas of communication with deaf patients. And after a few of these studies have been conducted and were read through, it's very evident that a lot of these healthcare professionals, especially nurses, don't feel like they are prepared enough to communicate with a deaf individual. Within these articles, it's become a reoccurring theme that deaf individuals are not feeling they are getting the proper medical care that they are needing. And like I said previously, a lot of healthcare professionals aren't equipped with the proper strategies to effectively communicate with deaf individuals. And this can ultimately lead to misdiagnoses or the incorrect medical advice, since the patient cannot communicate what is necessary and the doctor isn't able to communicate their expert opinion simply because the communication techniques and strategies aren't there. And that's why they need to be significantly improved within the schooling that these healthcare professionals and nurses go through before entering the field. Now, naturally, it's completely normal for someone who isn't deaf to completely grasp how these deaf individuals feel, and that's why I feel like the creation of this website will allow people to finally be able to see that there is feelings with the deaf community in how they feel that they aren't given the proper communication that they well deserve, and that's why it's important to learn about the different strategies that are out there to ensure that these patients are getting the correct communication that they're well deserved of. In addition to the articles that I provided on this website, I also was able to provide several different videos that show top ASL signs for medical emergencies, learning how to sign medical signs in ASL, as well as a few videos on just improving health communications with deaf patients, as well as tips for communicating with someone who has hearing loss. It's one thing to read articles, but it's another to visually see the different tips and techniques that are provided to ensure that the communication with deaf patients are improved and that these patients are getting the correct medical care that they are in the healthcare setting for. One of the most important things when communicating with deaf individuals is that they need to see your mouth when you're speaking. You need to be directly interacting with them. You can't be looking away, doing your own thing while trying to speak to them because obviously they're unable to hear you. So they're hearing through your mouth. That's how they're understanding what you're saying. So some of the different other tricks and tips that have been provided through the different articles and videos that I provided for you guys on this website is to book an interpreter. So that can make things a whole lot easier for the patient as well as the healthcare provider because this interpreter will understand how to effectively get across what each other are saying to one another. It's also really important to use normal lip movement when speaking to them because they have become accustomed to reading people's lips when they're speaking. So if you're exaggerating what you're saying, which one can be very rude and very demeaning to them, but if you're exaggerating what you're saying, they may not understand what you're saying at all because that's not how they're used to seeing words be said. Next, a different tips and tricks would be to use pen and paper if you happen to not have an interpreter or if you think it would be easier to get information across. That's a very effective way to do things, like I said before, because deaf individuals do learn to read and write at a young age, so that is a communication that you'll both be able to understand. Another really important strategy is to periodically check with your patient that they're understanding what you're saying. If a healthcare provider or nurse in this instance is just speaking and not giving the patient a second to understand what is happening, that's a very big problem, especially if someone is deaf because they're going to need extra time to process or they may not understand fully from the beginning. So if you're laying all this information on them, it can become very confusing and difficult to help the patient in the way that they need. Overall, it's become very evident through viewing multiple videos and articles that communication within the healthcare setting when it comes to deaf patients and healthcare professionals is extremely lacking and needs immense improvement. And through this website, hopefully healthcare professionals that view it as well as everyday people that view it are able to see the different techniques and feelings that these deaf individuals go through and how to effectively communicate with them better.